Welcome back to Medical Monday. Tonight is all about your skin and keeping your skin healthy. If you have questions, anything from acne to skin cancer to cosmetic questions about Botox or the latest treatment on the cosmetic side of things, go ahead and give Dr. Bindlam a call. We're answering tons of questions and we have a lot to get through. But first, I want to ask, whether you are 16 or you are 60, what should everybody be doing to their skin every day?
Right. And I think I can summarize it by saying sun protection, or I should say UV protection, ultraviolet protection, because you can obtain ultraviolet radiation from either natural sunlight or you can get it from the use of tanning beds. The American Academy of Dermatology has specifically said, and I definitely agree with this, that there is no such thing as a safe tan. And how I like to explain that is the tanning mechanism is a protective mechanism that your skin creates when it recognizes injury. So the very fact that your skin tans, it's because it's only recognizing injury. And one of the things that people don't realize is that when they have a tan and they say, I need to get my base tan before I go to the beach, the tan that they're talking about only delivers an SPF equivalent, sun protective factor equivalent, of about 4.
Okay.
Whereas the FDA recommends a SPF of 15. The American Academy of Dermatology actually recommends a SPF of 30 for everybody, from young to old. And that's very important because you're only going to have one skin to live with your entire life. And so you need to take care of it from the time that you're young well into your senior years. Over 1 million cases of skin cancer, new skin cancer cases, will be diagnosed every year.
1 million?
1 million every year. And actually, melanoma, which is one of the most deadliest kind of skin cancers, is the most common cancer among young people between the ages of 25 to 29.
That's scary.
And it is the second most common cancer in individuals between the ages of 16 to 29.
Wow.
And one of the things that people probably realize is that a lot of young people like to use tanning beds. And they use tanning beds in order to get color to their skin. And they're misunderstanding that base tan is protecting them against a sunburn. That misunderstanding is what leads them to get sun damage and therefore get not only premature aging of their skin, but also increased risk for skin cancer, including melanoma. And we do recommend, as far as sun protection, a SPF of 30, but use a broad spectrum sunscreen so that it covers against UVA and UVB. I myself also recommend that people should use a physical block as opposed to a chemical sunscreen. The difference is the following. When you use a chemical sunscreen does not work right away. You have to apply it and wait 20-30 minutes before it penetrates the skin and forms a chemical bond with the skin in order to serve as a protectant. And so that's why a lot of the labels for chemical sunscreen will say you need to apply it 15 to 30 minutes before you go outside. A physical block, such as micronized zinc or titanium, as a physical block, it does not have to form that bond with the skin. As a physical block, it starts working right away. The fact that I said micronized zinc is very important because micronized zinc would not look pasty white on individuals.
It's not the white streaks that we think of, you know, putting on your kids.
Exactly. So that, I think, is very important. And also, when you use chemical sunscreen, you can develop allergic reactions to the chemical. A physical block is inert, so it's not going to react like a chemical sunscreen.
Good information. Let's jump back to the lines. We have Shannon on the line waiting ever so patiently. Shannon, what's your question tonight?
Yes, hi. I would like to ask the doctor about the treatment of leg veins and about sclerotherapy.
Okay, thank you, Shannon. Go ahead, Dr. Bindlam.
So with leg veins, there are 2 types of treatment that can be used, and you want to think of it as injection of leg veins.
Are we talking about like varicose veins or spider veins? What are we talking about?
All of that.
Okay.
So when we talk about leg veins, in my mind, I'm thinking of it could be anything from small little red tiny spider veins to kind of the smaller greenish veins to then even varicose veins, which are the big, thick, ropey veins. Okay, so the two main methods of treatment is going to be sclerotherapy, which is injection of leg veins, and right now there is a single product that's FDA approved for injection of leg veins, and it's a product that contains a chemical called polydocanol, which is FDA approved for injection of veins. The other way is going to be the use of lasers and radio frequency energy. You can deliver the laser from outside the skin for treating smaller veins, or you can deliver a laser fiber into the vein in order to heat up the internal lining of the vein and cause it to shrink and collapse. And you can also use a fiber with radio frequency energy that serves the same purpose.
So how do you decide which one to do?
It depends upon the size of the vessel, where it is on the legs. I find that a lot of the times the things that bother a lot of people is not per se the large varicose veins. It starts off with the small spider veins and what I call the reticular veins, which are the bluish green veins. And those things over time, when they don't get treated, they do start to expand and get larger and ultimately become varicose, which are the big, thick, ropey veins. So treating it early is actually, in a way, preventative.
Does it go away for good then, or is this a continuous thing you have to keep up with?
Yeah, the veins that are effectively treated are gone for good. However, there are certain factors that lead to the development of leg veins in general. And some of the common factors, unfortunately, number one is being female. Number two is pregnancy. Third is being on birth control pills. Fourth is being on your feet a lot. Fifth is going to be actually injury to the legs. Sixth is going to be smoking, gaining weight. So there's a lot of factors. So those factors will lead to the development of new veins.
This may be a myth, but I've heard it often. If you cross your legs, you're going to get these kind of veins. Is that true?
Actually, it's true to a degree.
Really?
To a degree, yes. It still is true to a degree. So,
is it because it cuts off circulation or what?
It leads to abnormal pressure in some areas of your legs. So therefore, it puts higher pressure on veins that are more distal.
Distant. It makes sense, yeah.
So that can happen. Yeah.
Crossing up the ankles, I guess, then no longer at the knees. Shannon, thank you for calling in. We have Rebecca on the line. Rebecca, thank you for being with us. What's your question tonight?
What's the latest in lasers, and what is the difference between social downtime, and what does that mean?
All right. There's a lot of things that are new in lasers, and I think when Rebecca asked the question about what's new in lasers, I should expound upon that and say that in dermatology, we really talk about energy devices now, because we think of lasers as just being a light beam that's used to treat various conditions, anything ranging from brown spots to red vascular lesions that people don't like, broken capillaries of the face, used to treat wrinkles and the like, but now there are other energy devices that are used in dermatology. So other energy devices would be what's called intense pulse light. There's also using ultrasound energy, which is FDA approved to actually tighten the skin and lift the skin. There's also radio frequency energy that's also used to tighten the skin.
Could that be done anywhere on the body? I mean, I know a lot of people would like their face to look more youthful and tighter, but can it be done anywhere?
Yes, it can be. So it really depends upon the evaluation of the problem that people present with and what we see as being the optimal combination of things that can be done for people. And then now, also with energy, we also have dissolving fat through the use of cold energy. And so that's really fascinating, because who would have thought that if you correctly freeze fat while protecting the skin, you can actually get the fat to dissolve. And so people have probably heard of the term cool sculpting.
Yes.
And that is that process, and it was developed by several doctors at Harvard who came up with this idea from the simple observation that little infants and little toddlers who were sucking on cold lollipops, there would be some fat atrophy of their cheek from doing that. And so from that observation, they develop an elegant way of using cold energy to dissolve fat, and it's FDA approved for that, and it works very nicely for a lot of people.
Does it last, or is it something that you got to do every 6 months?
It lasts, but unfortunately, I'm guilty of this too, is that we can gain weight.
We have
over
our
time.
habits.
And
Sure.
so with that, sometimes we'll gain some unsightly new bulges that may need to get treatment. But the same is true when you do liposuction. And I used to do liposuction myself. And what I would always tell people when they had liposuction done is that what fat we remove, they're gone. But what fat remains, if you eat more and you gain weight, what fat cells remain will hypertrophy or thicken and get larger. So that can happen.
Interesting. Yeah. Okay, I'm learning so much here. I hope you are as well. We've got folks lined up. We're going to get to your calls and some Facebook questions right after the break. Stay with us.